starting forensic medicine with one of the most important or the preliminary topic to be covered under this subject, and that is injuries. In this video, we are going to learn about the definition of injury, the classification of injury under various bases, and in detail the various types of mechanical injuries. Now you might have two questions in your mind. Question number one, are these videos under forensic medicine enough for entrance point of view? And the answer is yes. Question number two, are these videos under forensic medicine enough from university paper point of view? And the answer is a big yes. So without any further ado, let's start with the definition of injury. Injury is defined in two ways, medically and legally. Medically, injury is defined as a breach in continuity of body tissue. For example, on my arm I have skin. In the skin there is epithelial tissue and the epithelial tissue is continuous. If I take a blade and cut my skin, then there is discontinuity in the epithelial tissue or a breach in the continuity of epithelial tissue. This is injury. So the breach can either be in epithelial tissue or muscular tissue or nervous tissue or connective tissue. If the breach is in epithelial tissue, for example, a cut on skin. Muscular tissue, a muscle tear, for example, triceps tear. Nervous tissue, diffuse axonal injury of the brain. And connective tissue, liver laceration or bone fracture. These also discontinuity in the continuity of the tissue or breach in the continuity of tissue. Legally, however, injury is defined as any illegal harm to an individual's number one, body, or number two, mind, or number three, reputation, or number four, property. For example, if you punch someone and he loses his sense of vision, there you are harming the physical body of that person. So when you punch someone in the face, or if you bully someone or blackmail someone, you are harming the mind of that person. Or you defame someone, an act of defamation results in harming the reputation of that person. Or if you destroy someone's car, an act of vandalism ends up harming the property of the individual. So legally, as per IPC section 44, injury is an illegal harm to an individual's body, mind, reputation, or property. So with that definition done, next, classification of injury. Number one, on the basis of causative agent, injury can either be kinetic or non-kinetic. Under kinetic, non-kinetic. Under kinetic injury, you have all the mechanical injuries. And under non-kinetic injury, we have thermal injury, electrical injury, blast injury, chemical injury, and radiation injury. Chill. Next, on the basis of severity, we have either a simple hurt or a grievous hurt. Now, whether an injury is a simple hurt or a grievous hurt is defined by the constitution of that country. That means these injuries classified on the basis of severity holds a legal importance. For example, if you injure someone and the more the grievous the injury you have inflicted is, the greater the punishment you will receive by law. Next is on the basis of manner of injury. For example, if someone injures you with the intent of killing you, that's homicidal. If you injure yourself with the intent of killing yourself, that's suicidal. If you get injured on accident, that's accidental. And if you try to fake an injury, then that's fabricated. What is fabricated injury? Fabricated injuries are artificial injuries or fake injuries. Why are they created? For example, let's say someone is trying to defame you by telling that you have beaten him up, but in actuality you haven't even touched him. As evidence, the police tries to find for injuries on the body of the victim, so-called victim. But then there are no injury. What the victim can do is use various techniques to create fake injuries on himself. For example, he can use some plant juice to create fake bruises, artificial bruises. These fake injuries or artificial injuries are referred to as fabricated. They are not real, they are fabricated. Next is on the basis of time. If the injuries were inflicted before death, that's pre-mortem injury, and if they were inflicted after death, that's post-mortem injury. All right. With that, classification of injury is also done. Now the topic that you guys have been actually waiting for, and that's mechanical injury. First definition. Mechanical injury refers to kinetic injury inflicted due to a mechanical force or a physical or a mechanical force. All right, classification. Mechanical injury is classified on the basis of striking surface. I repeat, listen carefully. On the basis of, a lot of you guys get it wrong, striking surface of the weapon. It is not classified just on the basis of weapon itself, but instead on the basis of striking surface of the weapon. It's not mentioned in lots of books, and even teachers while teaching don't explain this properly. See, what is this? This is a pair of scissors. Can this be used as a weapon? Yes, this can be used as a weapon. Is it a single weapon? This is a single individual weapon. How can I use it? See, I can use the blunt handle of the scissor, to strike you, to cause blunt force injury. Or I could use the sharp edge of the scissor to cut your throat, to split your throat, causing sharp force injury. Or I could use the pointed end of the same scissor to penetrate your body, to stab your guts out, causing a puncture injury. So here's the weapon is the same. It's the pair of scissors. But depending on the striking surface of the same scissor, you have different types of mechanical injuries being inflicted on you. So when I used the blunt handle of the scissor to strike you, you were inflicted with a blunt force injury. When I used the sharp margin of the scissor to cut your throat, it inflicted sharp force injury. And when I used the pointed end of the scissor to penetrate inside your body, it inflicted puncture injury. So that's how you have blunt force injury, a sharp force injury, and a stab force injury. Under mechanical injury, the gunshot injury is also mentioned, but that will be taught in a different video of its own. Under blunt force injury, you have 4 different types of injuries. So there's abrasion, there's bruise, there's laceration, and then finally fracture. I'll explain them all with the help of a single diagram. So for now, I'm just jotting them down. Try just to remember the names of these different injuries. Sharp force injury, depending on whether it is as a result of a light cutting weapon, for example, a knife, right? Light cutting weapon, a knife or a scalpel, you get incision. But if it is a heavy cutting weapon, right? Heavy cutting weapon like a chopper on an axe, you get a chop. Due to a stab force injury, you get a puncture wound or a puncture injury. Okay. With that, we are done with the classification of mechanical injury as well. Now, let me show you all these various types of mechanical injury with the help of a single diagram or a single piece of skin tissue. So the outermost layer of the skin is your epidermis. Just below epidermis is a much thicker layer referred to as dermis. Remember, epidermis doesn't have any blood vessel. So an injury to epidermis does not lead to bleeding. Similarly, injury to epidermis does not lead to scar formation. Dermis contains blood vessels. So an injury to dermis leads to bleeding as well as scar formation. The very first type of mechanical injury is abrasion. In abrasion, remember, it is only the epidermis that is involved. There is scraping of the epithelial tissue of the epidermis. As a result, in abrasion, there is no bleeding and there is no scar formation. Abrasion is also the most common type of mechanical injury, plus it is the most medico-legally important type of mechanical injury. However, sometimes the abrasion might be deep enough to reach papillary dermis, and when the abrasion reaches papillary dermis, then there can be little bleed. Next in line is bruise. In bruise, what happens is that following a blunt force injury, the blood vessels in the dermis gets ruptured. There is rupture of the blood vessel in the dermis. As a result, the blood from inside the blood vessel leaks out, or there is extravasation and there is clot formation. Some of this blood, it leaks into the dermis, which is appreciable in the form of discoloration over the skin. So this discoloration over the skin accompanied with the blood clot underneath is bruise. Following bruise, you have laceration. Laceration means to tear. If you take a piece of paper and tear it, what do you get? You get irregular margin of the torn paper. Similarly, if you take your skin and tear it, what do you get? You will get the irregular margin of your skin. Irregular margin of the skin like this. So this is laceration. Then below the skin, there's muscle and then there's bone. When the bone gets broken, this is referred to as a fracture. So abrasion, bruise, laceration and fracture, they fall under blunt force injury. These are all blunt force injury, BFI. Up next, sharp force injury. Under sharp force injury, there are two. One, due to a light cutting weapon, you get an incision. So this is an incision due to a light cutting weapon. See, laceration means to tear. Incision means to cut. When you tear a piece of paper, you get irregular margin. When you cut a piece of paper, you get regular sharp margin. Similarly, when you tear your skin, you get irregular margin. And when the skin is cut, you get regular margin. That's how you differentiate laceration from incision. Then another sharp force injury is as a result of a much heavier cutting weapon, and that leads to a much bulkier, larger cut, which is referred to as a chop. In chop, even the organs underlying the skin like bone, muscles, they get damaged and fractured. Alright, with that you are also done with the sharp force injury. Okay, you are done with the sharp force injury. And finally, you have stab force injury. What do you get in stab force injury? In stab force injury, you get a stab. Now the question is, how do you differentiate a stab from an incision? Both of them have regular margin. The difference is in the dimension. See, this is a puncture wound. This is a puncture wound or a stab wound. In incision, the length is greater than the depth. But in stab or puncture, the depth is longer than the length. Come on, it makes sense. Just Look here. If I use a sharp object to inflict an incision like this, it's gonna be against the skin like this. As a result, the length is going to be longer than the depth. But if I use the pointed end of a weapon to stab my body, then it's gonna penetrate inside my body. As a result, the depth is gonna be more than the length. On one hand, in case of incision, I'm just cutting the tissue, right? So the length becomes greater than the depth. On the other hand, in stab force, in puncture, I'm penetrating the tissue. So the depth is gonna be more than length. Okay, time for revision. What do you see here? You see only the epidermis is involved and there is no bleeding. So this is obviously abrasion. What can you appreciate? I can appreciate the length of the abrasion and the breadth of the abrasion. So length times breadth. Second, what do you see? I can see discoloration over the skin, probably due to a clot underneath. So this is a bruise. What can you appreciate? I can appreciate the length of the bruise and the breadth of the bruise. So length times breadth. However, in a dead body, in a cadaver, if I cut the bruise, if I incise the bruise, I can also appreciate the depth of the clot, that is how deep the clot is. Or this is what I mean. So I can appreciate the length of the clot, I can appreciate the length of the bruise, I can appreciate the breadth of the bruise, and if I cut or incise the bruise, I can also see how deep the clot is. Then here, what you can see? You can see a tear in the tissue and the tear has irregular margin. So this is most probably laceration. You can appreciate the length of the laceration, the breadth of the laceration and the depth of the laceration. So length times breadth times depth. Finally, what do you see here? You see a regular margin with lots of bleeding as well. This is a cut. I can appreciate this is a cut, this is a light cut or incision. I can appreciate the length, I can appreciate the breadth, I can appreciate the depth as well. So length times breadth times depth. See, another way you can differentiate between incision and laceration is in terms of bleeding. Okay, fine, laceration has irregular margin and incision has regular margin. Along with that, in laceration, the base is crushed. As a result, the blood vessel is crushed. So there is less blood that leaks out. So there is less bleeding. However, in incision, the blood vessel is freshly cut. As a result, blood can come out very easily. So there is more bleeding. That is why here you can see there is less bleeding, and in a incision, you can see there's lots of bleeding. What is this? This also has a regular margin. So it's a cut. It's a cut force injury. It's a sharp force injury. But then this sharp force injury is much vigorous, larger in size. It has even led to fracture of the skull underneath. So this is a sharp force injury due to a heavy cutting weapon, that is a chop. Length times breadth times depth can be appreciated. Finally, what is this? Here, a pointed weapon has been used to penetrate inside the neck of this person like this. Right? So this is a puncture wound. What can you appreciate? I can appreciate the length of the puncture, the depth of the puncture, the breadth of the puncture, and how deep the weapon was inserted. That is the depth of the puncture. I can appreciate the length of the puncture, the breadth of the puncture, and the depth of the puncture. And with that, I have given you the basic overview of all the various types of mechanical injury. Now, let's dive deep into each one of them one by one. Starting off with abrasion. First things first, definition. Abrasion means to scrape. So, it can be defined as either the scraping or the crushing of epidermis. Second, morphology. Morphology. So in abrasion, it is only epidermis that is most of the time affected. Sometimes papillary dermis is affected. And here scraping or crossing of the epidermis takes place. So let's draw the epidermis. Here is the epidermis. A part of this epidermis is scraped to one end. So, and the part that has been scraped is heaped up or collected to that end. This collected part of the epidermis, right, is referred to as the epithelial tag, which gives the direction of force. The direction of force is along the direction of epithelial tag. Array, don't use your brain so much, just listen. See, here's the epithelium over my skin, right? What I'm doing is scraping the epithelium. As the epithelium gets scraped, it gets collected at one end in the form of epithelial tag. So, the epithelial tag, it is in the direction of the epithelial tag that the abrasion takes place. If epithelial tag is here and the rest of the abrasion is here, it means the scraping took place in this direction. That is the force, the direction of force was in this direction. Or let's say if the epithelial tag is here, and the rest of the abrasion is here, that means the scraping took place in this direction. That is the direction of force of injury. The direction of force was in this direction. Got it? Okay. Next is the types of abrasion. Abrasion, it's of two types on the basis of direction of force. If the force is along the line of the epidermis, that is, it is tangential, then we get scraping abrasion. If the direction of force is perpendicular to epidermis, then we get crossing abrasion. So in scraping abrasion, the epithelium gets scraped to one end, forming epithelial tag, and crossing abrasion, the epidermis, the epithelium gets crushed by the perpendicular force. Under scraping abrasion, you have two types. You have scratch abrasion and graze abrasion. Scraping is abrasion where individual lines of abrasion are appreciated is scratch abrasion. Scraping abrasion where a continuous band of abrasion is appreciated is graze abrasion. See, in scratch abrasion, you can look at these individual scratch lines, individual abrasion lines. While in graze abrasion, it seems as if cows, they have grazed over your skin and continuously removed the epithelium from over your skin. Scratch abrasion can be as a result of nail, pin or thorn, and graze abrasion is most commonly seen in road traffic accident. Graze abrasion is also known as friction burn. Why? Because graze abrasion is as a result of friction between epidermis and a rough surface. It is also known as gravel rash because the friction is between the epidermis and the rough surface, which is most probably gravel. Next is crossing abrasion. Within crossing abrasion, you have two types: pressure abrasion and impact abrasion. Pressure abrasion is such a crossing abrasion where less force is applied for a longer period of time. Impact abrasion is such a crossing abrasion where more force is applied within less frame of time. Example of pressure abrasion is ligature mark. See, when you hang yourself and put a ligature around your neck, tie a rope around your neck, pressure is being applied on your neck for a long period of time at a small force, which results to pressure abrasion. Example of impact abrasion are radiator grill mark. Let's say you get into a road traffic accident where a car comes and hits you. As a result, the radiator grill of the car, it strikes your body at a large force in a small frame of time, creating abrasion on your body that looks like the radiator grill of the car itself. Another is horse kick, large force in a small period of time, resulting in impact abrasion. Be it pressure abrasion or impact abrasion, right? If it is associated with a pattern, we call it pattern abrasion. Pattern abrasion. With that, you are done with the various types of abrasion. Next, aging of abrasion. Now, the aging of abrasion is dependent on the color of scab. What is scab? Scab is formed over the abrasion as the abrasion heals. So, one way to remember is triple R, triple B. So, triple R and triple B. This gives the color of scab, and that gives the time or age. Raw means with no scab. Red is brown, and finally black. So if it is raw without scab, it's less than 12 hours. If it's red, it's more than 12 hours. If it's reddish brown, it's 2 to 3 days. If it's brown, it's 4 to 5 days. And if it's black, it's 6 to 7 days. So it takes overall 7 days for abrasion to heal. But we don't just stop there. Once there is black scab formation, it eventually falls off. So the scab falls, and what you get is hypopigmented skin. Hypopigmented. This is from 7 to 12 days. And it is after that the skin is replaced by new epithelium. This is after 12 days. Okay, so this is it. Just remember R, B, less than 12 hours, more than 12 hours, 2 to 3 days, 4 to 5 days, 6 to 7 days, and you are good to go. Okay, let's do some practice questions. You can see that the scab is brown in color. Now, how old is this abrasion? Remember, R, B, raw less than 12 hours, red more than 12 hours, reddish brown 2 to 3 days, brown 4 to 5 days, and black it's 6 to 7 days. The color of the scab is brown, so it is most probably 4 to 5 days. Next, the scab is black in color. So R, B, red less than 12 hours, raw less than 12 hours, red more than 12 hours, reddish brown 2 to 3 days, brown 4 to 5 days, black 6 to 7 days. So it's probably 6 to 7 days. But no, see, the scab is about to fall off with hypopigmented skin. That is 7 to 12 days. So it is probably 7 to 12 days old. Next, you can see that there are areas without scab where the scab has fallen off and there is hypopigmented area, and then there are areas with brown scab, dark brown scab, right? So overall here the age is 7 to 12 days because the scab has fallen off and there are hypopigmented areas. Then differential diagnosis. So these are the conditions that might be confused with abrasion, but they in actuality are not abrasion. For example, insect bite. The one that I have shown here is a cockroach bite. It could even be from an ant. Next, excoriation of skin. What I have shown here is a diaper rash. Next is pressure ulcer. What I have shown here is a bed sore. Next, eczema. What I have shown here is scrotal eczema. Then, how do you differentiate whether the abrasion was inflicted before death or after death? This is how. First, site. Before death, it can be anywhere. But after death, it is most probably over bony prominence, because while handling the body, abrasion might be there over bony prominence. Color, it's red due to blood. After death, the body is pale and the abrasion is yellow. Scab, there is scab formation before death. After death, there is no scab formation. Vital reaction, there is vital reaction and changes, inflammatory changes before death. There are no vital reaction and inflammatory changes after death. And with that, we are done with abrasion. Let's revise abrasion once. All right. Definition of abrasion. Abrasion means to scrape. So abrasion can either be scraping or crushing of epidermis. Morphology. Abrasion mostly involves only the epidermis, and it mostly includes the scraping of the epidermis. So here the epidermis gets scraped to one end and collected to that end. The collection of the epidermis is called the epithelial tag, which also determines the direction of force. The direction of force causing abrasion is along the direction of the epithelial tags, or towards the direction of epithelial tag. Next is the types of abrasion. It is divided into two types on the basis of direction of force. If the direction of force causing abrasion is tangential, it leads to scraping abrasion. If the direction of force causing abrasion is perpendicular, then it causes crushing abrasion. Scraping abrasion are of two types: scratch abrasion, where you can see individual lines of abrasion, or graze abrasion, where there is a continuous band of abrasion. Scratch abrasion can be as a result of nail, thorn, or pin. For example, a cat scratch, or I scratch you with my nails. Graze abrasion example is most common: road traffic accident. In road traffic accident, when you fall off from a bike, your elbow scratches against the gravel of the road, resulting in graze abrasion, friction burn, or gravel rash. The crossing abrasion is of two types. If there is less pressure applied for a long period of time, it leads to pressure abrasion. For example, ligature mark in hanging. Or if large force is applied in a less period of time, it leads to impact abrasion, like when a car hits you and the radiator grill leaves a mark on your body due to impact abrasion. Be it pressure abrasion or impact abrasion, if it creates a pattern over your body, pattern of abrasion, it is referred to as a patterned abrasion. Aging of abrasion. So the age of abrasion is determined by the color of the scab. If there is no scab and it is raw, it's less than 12 hours. If it is red, it's more than 12 hours. If it is reddish brown, it is 2 to 3 days. If it is brown, it's 4 to 5 days. If it is black, it is 6 to 7 days. If the scab has fallen off and what you have is a hypopigmented skin, it's 7 to 12 days. And if it is replaced by new epithelium, it's 12 days. So overall, the total healing time it takes is 7 days. And the way you can remember it is RRR. Differential diagnosis of abrasion are: these are the conditions that might be confused with abrasion, such as insect bite by cockroach or ant, excoriation of skin such as diaper rash, pressure ulcer such as bed sore, or eczema such as scrotal eczema. The way you can differentiate abrasion that was inflicted before death from after death are: number one, before death it can be anywhere. After death it is most commonly over bony prominence. Before death the abrasion is red. After death, if there is abrasion, it is yellow due to lack of blood. Before death there is scab formation. After death there is no scab formation. Before death there are vital reaction. After death there is no vital reaction. And with that you are done with abrasion. Next you have bruise or contusion. Definition: bruise or contusion. Bruise, it is discoloration of skin with clot formation underneath. You will understand this once I show you the physiology of bruise formation. But for now, just remember that bruise is associated with skin and contusion is associated with internal organs or visceral organs. Now let me show you the morphology of bruise with the help of physiology of pathophysiology. So here's the skin, right? This is the epidermis and below is the dermis. It goes through a blunt force injury. Due to the blunt force injury, there is rupture of blood vessel in the dermis, and the blood it gushes out. There is extravasation of the blood. The blood then collects, forming a clot. Some of the blood it seeps into the epidermis. As a result, there is discoloration of the skin. So this discoloration of the skin associated with clot formation underneath due to extravasation of blood from ruptured blood vessels as a result of a blunt force injury is your bruise. If this thing takes place in your internal organs, that's your contusion. Next, types. So types you have on the basis of level or depth or the layer of skin. Layer of skin. Okay, so here's your skin. There's the epidermis, and you know that it's the dermal blood vessels that get ruptured, right? So here's a bruise. Then there's subcutaneous tissue just below the dermis. Here's a bruise, or much deeper there's a bruise. So either the bruise can be within the dermis, which is intradermal bruise, or it can be within the subcutaneous tissue below the dermis, below the skin, which is subcutaneous bruise, or it can be way deeper, which is deep bruise. Deep bruise is also referred to as come out bruise. Why? So if it is an intradermal bruise, the blood would be present in the epidermis and discoloration would be visible. If subcutaneous bruise, the same thing would be there. But if there is a deep bruise, the discoloration is not present on the skin. It is only after 2 to 3 days, that some of the blood will seep into the epidermis and then the discoloration is visible. That is why it is referred to as come out bruise. That means there is a bruise, there is clotting of the blood which comes out after 2 to 3 days. And that is why it is important, very important for you as a doctor to call patients of domestic abuse for a follow-up. Because in first checkup, you might not find any bruise because the injury might be way deeper. But then after 2 to 3 days, when you call the person for follow-up, you might then be able to see the bruise over the skin, the discoloration over the skin, because the deep bruise have then come out. Okay, next you have patterned bruise, right? These are some special types of bruise. Patterned bruise, what I am showing here is your tram line bruise, which is as a result of lathi or rod. Here, as the lathi strikes your skin, there is compression underneath where the blood vessel gets compressed, right? But the blood vessel does not rupture. While along the sides of the lathi, along the sides of the rod, the blood vessel gets stretched. And where it gets stretched, it gets ruptured. And that is why once the lathi is removed, just below the lathi, the skin is normal, because this is where the blood vessel was compressed and there was no rupture of the blood vessel. But along the sides of the lathi, there is bruising, because this is where the blood vessel was stressed and the blood vessel ruptured. If you take the total breadth of the injury, you can find the diameter of the lathi. Next is six-penny bruise, which is seen in what? Which is seen in throttling. What is throttling? When I take my hand, press against your neck to asphyxiate you and kill you, that's throttling. So here's the first type of throttling, where only one hand has been used. So you can look at the bruise due to the thumb and 4 other bruise due to the rest of the 4 fingers, like this. These are crescentic abrasion as a result of nail, So these are nail marks. Here, both the hands have been used to throttle the person. So there is the bruising due to one thumb of one hand, and the rest of the 4 fingers go here, and then the thumb of the other hand and the rest of the fingers of the forehand. So the tip of the fingers and the thumb, they cause bruising over the neck, while throttling referred to as six-penny bruise. Then there's your butterfly bruise. Butterfly bruise, it's just butterfly bruise, is as a result of pinching. When you pinch the skin, right? So it can be seen in child abuse, and this can also be seen in child abuse. Here's the butterfly shaped bruise, due to pinching. Then what is this? A lot of you might be familiar, and quite a lot of you probably not, including me. This is a hickey or a love bite. This is as a result of suction over the leg during love making. And the next is a donut bruise. Donut bruise is as a result of spherical object like a cricket ball. So those are your patterned bruise. Okay, so you had the trimline bruise as a result of lathi or rod. You had sixpenny bruise due to the tip of the fingers as a result of throttling. You have butterfly bruise due to pinching, hickey or lob bite due to suction, and donut bruise due to spherical object. Next, you have ectopic bruise. What are ectopic bruise? Ectopic bruise are such bruise where the impact is somewhere else, and the bruising itself is somewhere else. Let's look at some of the examples. In first, you have raccoon eyes. So raccoon eyes, where's the impact? The impact is in the head. There is head trauma. But not just head trauma that leads to bleeding below aponeurosis. As a result, when there is bleeding below aponeurosis, the blood, it eventually collects around the eyes, resulting in raccoon eyes. This is battle sign, which is as a result of middle cranial fossa fracture. It is also a sign of child abuse. Next, you have the Cullen sign, Gray Turner sign, and Fox sign. In Cullen sign, there is collection of blood around the umbilicus. Gray Turner sign, the collection of blood in the flank, and Fox sign, collection of blood in the inguinal region. This is as a result of acute pancreatitis. Acute pancreatitis. And then there's your butterfly shaped hematoma. Butterfly shaped hematoma over scrotum and perineum. This is as a result of anterior urethra fracture. Ectopic bruise. There can even be fabricated bruise with the help of some plant juices. You can search on that on your own. Next, just like aging of abrasion, you also have aging of bruise. So, very easy to understand. First, the bruise blood is red in color because it contains oxygenated hemoglobin. Then eventually, the oxygenated hemoglobin becomes deoxygenated hemoglobin. So, the bruise becomes blue in color. Then there is iron that splits off the hemoglobin and collected in the form of hemosiderin, and this is brown in color. It's brown in color. Then the hemoglobin pigment is broken down to biliverdin, which is green in color. Then biliverdin is further broken down to bilirubin, which is yellow in color. And then finally, healing takes place by the end of 2 weeks. For the healing of abrasion, it took 1 week. For the healing of bruise, it takes place within or after 2 weeks. So, when the bruise is fresh, it's red in color due to oxygenated hemoglobin. When it's few hours to 3 days old, it's blue in color due to deoxygenated hemoglobin. When it is 4 to 5 days old, it is brown due to hemosiderin. And when it is 5 to 6 days old, it is green due to biliverdin or hemoitoidin. When it is 7 to 12 days old, it is yellow due to bilirubin. And by 2 weeks, it heals up. Now, how can you differentiate post-mortem hypostasis from contusion? See, contusion, bruise, same thing. Post-mortem hypostasis is after death, depending on the position of the body, there is collection of the blood due to gravity. If the body is in supine position after death, the blood gets collected over the back. If the body is hanging after death, then the blood gets collected in hands and feet due to gravity. Okay. How can you differentiate this collection of blood resulting in discoloration of the skin from discoloration of skin due to actual bruise? This is our first cause. It is due to blood vessel dilation after death. Contusion. This is due to blood vessel rupture due to blunt force injury. Location. This is in the dependent parts like the back in supine position, and hand and feet in hanging position after death. This contusion can be anywhere depending on where the injury was sustained. Color, it is bluish purple in color. Well, this depends on the age of the bruise. It can either be red, blue, brown, green, yellow, dependent on age. Margin, it is clear and distinguishable. Well, this merges with the periphery. You can't demarcate the margin. Blanching is positive, blanching is negative. When you incise post-mortem hypostasis and keep it under running water, the blood washes away. But if you incise a bruise and keep it under running water, the clot does not wash away. It doesn't wash away. So with that, you are also done with bruise. Let's revise bruise then. Okay, first, what is bruise? Discoloration over the skin due to clot underneath. Bruise is associated with skin, contusion is associated with internal organs. Morphology. So there is blunt force injury that results in rupture of blood vessel inside the dermis. As a result, there is extravasation of blood and formation of clot. Some of this blood seeps into the epidermis, leading to discoloration of the skin. Then types. If it is at the level of dermis, it's intradermal. At the level of subcutaneous tissue, it is subcutaneous. Or if it is much deeper, it is deep, which is also referred to as come out bruise, because the bruise comes out and is visible over the skin after 2 to 3 days. Patterned bruise. You have tramline bruise as a result of lathi or rod. You have six-penny bruise as a result of throttling. Butterfly bruise as a result of pinching. Hickey or lob bite as a result of suction. And donut bruise as a result of spherical object. Then ectopic bruise, raccoon eyes as a result of head trauma and bleeding below the level of aponeurosis. Battle sign due to middle cranial fossa fracture, a sign of child abuse. Cullen sign, great tunnel sign and Fox sign as a result of acute pancreatitis. Butterfly shaped hematoma as seen in anterior urethral fracture. Fabricated bruise, aging of bruise. So first it is red in color, then blue in color, then brown in color, then green in color, then yellow in color. As per the changes that take place in the hemoglobin as time passes, it is oxygenated, then deoxygenated, then there is iron collection, hemosiderin, then there is biliverdin formation green, then bilirubin formation yellow, and then it heals up. You can differentiate postmortem hypostasis and contusion in following way. Postmortem hypostasis is due to blood vessel dilatation. Contusion is due to rupture of blood vessel due to blunt force injury. Postmortem hypotension is a dependent part, while contusion can be anywhere depending on where the injury was sustained. Postmortem hypotension is bluish purple in color. Contusion depends on the age of the contusion. Color depends on age of the contusion. It is clear and distinguishable. Contusion is not clear. It merges with the periphery. Postmortem hypostasis shows blanching. Contusion does not show blanching. What is blanching? Blanching is when you press over the collection of blood and the blood gets pushed away, resulting in transient pale area. Postmortem hypostasis, when you cut and then try to wash away the blood will wash away. Contusion, when you make an incision over the bruise and then put it under running water, the clot will not wash away. Next is laceration. Laceration means to tear. Take a piece of paper and then tear it. What do you get? You get irregular margin. Similarly here as well, when the skin gets torn, you get irregular margin. And there's the epidermis. Okay. Now the morphology of the laceration is characterized by 4 things. Number 1, the margin is irregular. Number 2, the edges, they show bruise because it is as a result of blunt force injury after all. The edge shows bruise. Then there are also on top tissue breaches. And finally, since it is as a result of blunt force, the blood vessel at the bottom gets crushed, the hair follicles get crushed, and the nerve also gets crushed. So there is crushing of blood vessel, nerve and hair. Since the blood vessel is crushed, there is less space for blood to leak out, so there is less bleeding. Now this is what laceration looks like from side. How about from top? From top, this is the irregular margin of the laceration, and at one end, shallow tailing takes place. Shallow tailing, and around is obviously the bruising at the edge. The base is crushed. It is crushed. This is referred to as shallow tailing because it looks like the tail of shallow board. Okay. See, one concept that you need to know. Here's a blood vessel with two branches. This branch has been crushed and this branch has been cut. At the point where it has been crushed, there is less space for blood to leak out. So there is less bleeding. At the point where it has been cut, there is more space for blood to leak out. So there is more bleeding. That is why in laceration there is less bleeding and in incision there is more bleeding. Next, we have the various types of laceration. We have split laceration, stretch laceration and avulsion laceration. Under split laceration, this is what takes place. So we have a hard object that is going to impart a blunt force, and then you have a hard structure of your own body. Hard structure of your own body. In between the two is a soft tissue, or just above the hard structure is a soft tissue. For example, the hard structure can be your skull and the soft tissue can be the scalp overlying the skull. So this soft tissue is sandwiched and crushed in between the two hard structures. It is sandwiched and crushed in between the two hard structures. As a result, splitting takes place. Splitting, and this is referred to as a split laceration. So what you see here is a split laceration. Now, if you look at the margin of this laceration, it seems to be regular, but then lacerations are not supposed to have regular margin. That means, is it an incision? No, it's not an incision, because the injury is as a result of a blunt force, like a rod behind the head, a blow behind the head with a rod. It is as a result of a blunt force that you get this splitting. So it is a laceration, but since to naked eye it looks like an incision due to regular margin, it is also referred to as incised looking laceration. A very, very important terminology you need to know in clarity. Incised looking laceration. What is incised looking laceration? See, this in fact is a laceration because the splitting of the scalp has taken place as a result of blunt force injury. But since the margin looks to be regular, so the laceration looks like an incision. So we call it incised looking laceration. Now the question is the margin really regular? And the answer is no. It is just to the naked eye that the margin appears to be regular. But if you go ahead and use a hand lens to truly appreciate the morphology of the injury, you can appreciate the irregular margin. Not only that, you can also appreciate the crust base. Not only that, you can also appreciate the tissue bridges. So let me show you here in the diagram. I mean the real picture. So the margin seems to be regular, but if I use a hand lens, I can appreciate the irregularity in the margin. Similarly, the base is crushed, and you can also appreciate the tissue bridges over the injury, all the tissue bridges, That's your split laceration. Next is stretch laceration. Stretch laceration, I'm going to draw a skin, and there's the epidermis of the skin. And here's the blunt force with the help of a blunt object. Stretch laceration is characterized by, I repeat, it is characterized by pressure with pull. It is characterized by pressure with pull. So here the skin goes under pressure and gets pulled as well. As a result, a part of the skin gets pulled out. It gets pulled out. like this. But they're not completely detached. See, the part of the skin that has been pulled out is still attached to the base with the help of a pedicle. So the skin is not completely detached, and this is referred to as flapping of skin. The blood vessel or the vasculature of the skin is preserved. So this flap can be resutured back to its original position without any problem. And this is seen in open fractures. That's stress laceration. Next, avulsion laceration. Now, avulsion laceration is where you actually get detachment from attachment. That is, the tissue, the organ is completely detached from its site of origin. For example, this is a kidney. Here's the ureter of the pelvis and then the ureter of the kidney. Then the artery supplying the kidney and the vein draining the kidney. If this kidney is completely pulled off at the level of hilum, this is referred to as avulsion laceration. So this is kidney that has been avulsed. Another most classical example is that of a road traffic accident involving the wheel of a car and your upper leg or the thigh. So I'm going to draw the transverse section of a thigh. Here's the femur. Surrounding the femur are the muscles of the thigh, and then surrounding that is the skin. Now let's say this skin gets under the wheel of a car, under the tire of a car. As the tire spins around, it pulls the skin. It pulls the skin and completely rips it apart. It detaches the skin as well. This is also avulsion. What type of avulsion is this? This is referred to as flaying of skin. So the difference in flapping of skin and the flaying of skin is that flapping of skin is stretch laceration, where the skin is not completely detached from site of attachment. It is still attached via pedicel. It still has its vasculature and can be reattached back. But in flaying of skin, the skin is completely ripped off from its site of attachment. This cannot be resutured back. Okay, then other examples are amputation, like decapitation. Head is removed at the level of neck. And with that, we are done with laceration as well. Okay, let's revise laceration. Laceration refers to tear. When there is tearing of the skin, there is irregular margin. So there is irregular margin. Laceration is characterized by 4 features. Number 1, the margin is irregular. Number 2, the edges are bruised. Number 3, there are connecting breaches or tissue breaches. And number 4, the base is completely crushed. Since the base has crushed blood vessel, there is less blood that leaks out and less bleeding. This is from the side. From above, there is shallow tailing that can be appreciated. Then there are 3 types of laceration. First is split laceration. Split laceration is also referred to as incised looking laceration. In split laceration, a soft tissue is crushed between 2 hard objects, out of which one is the striking object and the other is the underlying body structure like the skull itself. Here the splitting of the tissue takes place where the margin seems to be regular, so referred to as incised looking laceration. But it is regular just to naked eye. If you look at hand lens, in reality the margin is irregular, there is crust base and there are tissue breaches which characterizes a laceration. In stretch laceration, there is pressure with pull resulting in flapping of the skin seen in open fracture. In avulsion laceration, there is detachment from attachment. The tissue, the organ is completely detached from its point of attachment. You can appreciate flaying of skin. Next up, we have sharp force injuries, which includes incision by a light cutting weapon and chop by a heavy cutting weapon. So incision is a sharp force injury. It's a sharp force injury due to a light cutting weapon like a knife or a scalpel. Morphology. Morphologically, it has irregular margin. Unlike laceration which has irregular margin, incision has a regular margin. So there's regular margin. And the blood vessel, instead of being crushed like in case of laceration, it is cut. Since the blood vessel is cut, there is more bleeding because the blood has more space to gush out. As for types, the types are on the basis of manner of incision. Manner of incision. If the incision was put by someone else with the intention to harm you, then that is homicidal incision. If the incision is put by yourself with the intention to harm yourself, that is suicidal incision. And if the incisions are there because you protected yourself against a homicidal attack, that is defense incision, also referred to as homicidal cuts, suicidal cuts, and defense cuts. First, homicidal cuts. They are also referred to as beveled cuts morphologically, because here the cut is beveled or at an angle. You can see that the cut is at an angle. And this angle made by the cut with the sharp weapon is hidden under the tissue. It's kind of hidden under the tissue like this. So it's hidden under the tissue. This is referred to as undermining edge. Undermining edge. See what is happening. Here the sharp weapon is used, the sharp weapon brings about an incision at an angle, and this incision is hidden under a tissue, flap of tissue. This is referred to as undermining edge. Here the cut is single and deep. It is deep because the intention is to harm you. The intention is to end your life in a single slash, in a single blow. So that's your homicidal cut. See, whenever someone tries to strike you with a sharp weapon, they are going to strike you at an angle, right? And that is why you get incision at an angle. And an incision at an angle is referred to as beveled cut. And whenever there is a beveled cut, the cut is hidden under a tent of tissue, and this is referred to as undermining edge. Usually it's a single strong deep slash because someone is trying to finish you off. Next, suicidal cuts. These are also referred to as hesitational cuts. These are most commonly seen over the wrist, where you are trying to end your own life by cutting your wrist. And when you cut your wrist, when you try to cut your wrist, you don't cut it at an angle. You don't slice it at an angle. You slice it at a straight line, in a straight line. And obviously, at first attempts, you are hesitating. So you are hesitantly cutting. Since you are hesitantly cutting, there are going to be multiple incisions. And finally, there's going to be one single cut which is deep enough to finally kill you. That is why it is also referred to as hesitational cuts, because you hesitate to cut yourself, so there are multiple cuts. These are also referred to as tentative cuts, because first there are cuts that are tentative and finally a final cut. Or intentional cut, because you are intentionally cutting yourself, intentional cut. Or trial cuts, because there are multiple trials that take place, right? Trial cuts. See, overall, there are multiple and superficial. They are multiple and superficial, and they are present at accessible part, like your wrist. It's an accessible part. You can easily cut there. You can see that this person has also resulted in multiple attempts, hesitational cuts, trial cuts, and finally there was one deep cut. Then there are defense cuts. The defense cuts, they are of two types. Either you have active defense cuts or passive defense cuts. Here, someone is trying to strike you and you are protecting yourself or defending yourself. Either you can protect or defend yourself actively by directly grabbing the weapon, or you can protect yourself passively by blocking the strike of the weapon. When you actively see, either you actively grab the weapon or you block the weapon. When you actively grab the weapon, the sharp edge of the weapon, where does it go and cut? It will go and cut in the first wave space of your palm. It will go and cut in the first wave space of your palm. So it's seen in the first wave space. In passive, when you try to block, where are the cuts going to be? The cuts are going to be over the fingers, over the palm, or over the ulnar border of the hand. Obviously, you are not going to protect yourself like with the radial border. It's going to be with the ulnar border, right? When you're protecting yourself, the ulnar border is facing the perpetrator, the attacker. So the ulnar margin, palm and fingers. Okay. So I showed you morphology from the side. What about morphology from the top? So from the top, an incision looks spindle shaped with the tail at the end. Okay, it looks spindle shaped with the tail at the end. So in case of laceration, there was shallow tailing. In case of incision, in case of laceration, there was shallow tail. In case of incision, there is tailing. So this is the head and this is the tail. At head, more force is applied, so there is more depth. At tail, there is less force, so there is less depth. And the tailing also gives you the direction of force, which is along the direction of tailing. So it is really easy to understand. If I put an incision over my palm like this, over my hand like this, okay, incision over my hand. First, I'm going to put a lot of force into the incision. Then as it cuts through the skin, finally I'm going to lift my arm and the weapon is going to get lifted. As the weapon is going to get lifted, the depth of the incision decreases. First, high application of high force, large depth. Then as you incise, then the weapon is lifted up, the depth decreases, the force decreases, the depth also decreases, and tailing occurs. That is why the direction of the force is also from head to tail, from more depth to less depth, from the start to the tailing. You can appreciate the following dimensions. You can appreciate the length, you can appreciate the breadth, and you can also appreciate the depth. So length times breadth times depth. What you need to remember is that the breadth of the cut is usually more than the thickness of the weapon itself. That is because of gaping. Due to the collagen fibers over the skin, it pulls the wound apart and gaping takes place. That is why the spindle shaped wound and breadth more than the breadth of the wound itself more than the thickness of the weapon. Okay. Up next, very important topic. Difference between laceration and incision. See, this is laceration with irregular margin, with bruising at the edge, and crust base. The base is crust base. Since the base is crust, the blood vessel is crust and there is less bleeding, and tissue breaches. So there are four things. First, the margin is irregular. Second, the edge shows bruising. Third, the base is crust, so there is less bleeding. And fourth, there are tissue breaches. However, in case of an incision, the margin is regular margin. There is no bruising at the edge, and then the base, instead of being crust, it is cut, so there is more bleeding. Cut base, so there is more bleeding, and there are no tissue breaches. The tissue breaches are not there, no tissue breaches. So these are the 4 differences between laceration and incision. Next, difference between incised looking laceration and laceration looking incision. Okay, so incised looking laceration is also referred to as split laceration. How does split laceration takes place? Split laceration takes place when a soft tissue is crushed between 2 hard objects, where one of the hard object is the striking hard object and the other hard object is the hard structure of the own body underneath. This is the hard body structure underneath the soft tissue. For example, in this case, it's the skull and the soft tissue itself is the scalp. So the scalp gets crushed in between the striking hard object and the skull underneath. It is sandwiched and then crushed. As it gets crushed, it splits. Splitting takes place, and that is why it is referred to as split laceration. But with naked eye, when you see, you can see a regular margin. Now the thing is, laceration has irregular margin, incision has a regular margin. That means, is this an incision? No, because the injury is as a result of a blunt force. So it is laceration. But then the margin seems to be regular to naked eye. But when you actually go ahead and use a hand lens, you can actually appreciate the irregular margin. You can appreciate the crust base. You can appreciate the tissue breaches, which are characteristic of laceration. And that is why this is referred to as incised looking laceration, because to naked eye it looks like an incision, but when you actually go ahead and use a hand lens, you can appreciate the characters of laceration. Then you have laceration looking incision. Very easy. Laceration looking incision is actually sharp force injury. There is sharp force injury, I repeat, but then it looks like laceration to the naked eye. This can either be due to serrated knife, which has, see, this is a serrated knife, or it could be due to incision at axilla, groin, etc. At these regions, due to the skin itself, the skin texture itself, the incision looks like a laceration. With that, we are done with incision as well. Let's revise once. So what is incision? It is a sharp force injury due to light cutting weapon. Morphologically, it has a regular margin and the blood vessel is cut instead of crushed, so there is more bleeding. When you look from top, you can look at the spindle-shaped cut with tailing. The direction of force is in the direction of the tailing. And the types of incision are on the basis of manner of incision, either homicidal cuts, which are beveled cuts, that is cuts at an angle, which gives off a tent of tissue which covered the cut under it, also referred to as undermining edge. Then suicidal cuts, which are also referred to as hesitational cuts, where the person cuts himself, especially over the wrist, and there are multiple attempts at cutting himself. Then defense cuts, which can either be active, where the person tries to grab the weapon itself, as a result there is cut at the first wave space, or passive defense cut, where the person tries to block the attack, so there is cut at the level of palm, fingers and ulnar margin. Laceration versus incision, look at the margin, look at the edge, look at tissue breach, look at the base. Incised looking laceration is nothing but split laceration, and laceration looking incision is nothing but incision due to serrated knife or incision at axilla groin. Next, we have chop. Chop is nothing but a sharp force injury due to a heavy cutting weapon. This heavy cutting weapon can either be an axe or a chopper. For example, Here's the axe. This is the toe end of the axe and this is the heel end of the axe. What is the significance? The significance is that when someone tries to chop with the help of an axe, it is the heel end that strikes first and then the toe end it leaves later. See, here's a piece of tissue. The axe is used to strike. The heel end touches first and then the axe moves in this direction and there is incision like this. Here's the heel end and then here's the toe end. Okay, let me show the same thing more clearly. So here's the morphology. Here's a chop, here's the heel end and here is the toe end. The heel end comes first and the toe end comes second. The heel end is deeper, the toe end is shallower. Here also you have regular margin, but there is a much larger gaping cut. See, chop is actually a combination of sharp force injury, which is due to the sharp surface of the weapon, plus a blunt force injury, which is due to the heaviness of the weapon, due to the heaviness of the cutting weapon. So it's a combination of both. So due to the sharp force injury, you get the cut, the large cut, and due to the blunt force injury, you get bruising all around. Okay. Also, if you look at the base contains organ that is destroyed or bone that is fractured. And with that, you are done with chop as well. Next is stab. So stab force injury leads to puncture wound or the stab itself. How is it defined? It is nothing but the puncture wound due to pointed weapon. Puncture wound due to pointed weapon. For example, if I use this pointed weapon to stab myself, penetrate myself, this will lead to a puncture wound. Morphologically, so I'm going to show this with the help of a three-dimensional space. So let's say this right here is a piece of tissue that is going to get punctured. A piece of tissue that is about to get punctured. Okay. Now here's the puncture wound. This is the puncture wound. In this tissue, here's the puncture wound. Now if you look at this puncture wound, this right here is the length of the puncture wound. This right here is the breadth of the puncture wound. And this right here is the depth of the puncture wound. Okay? Okay. Now, let's say the weapon that was used to inflict this puncture wound is this right here. Here's the weapon that was used to inflict the puncture wound. This is the length of the weapon. This is the breadth of the weapon. And this will give you the thickness of the weapon. In complete penetration, that means when the weapon is completely inserted inside the tissue, what happens? The length of the weapon is equivalent to to the depth of the wound. The depth of the wound. But there are some exceptions where the length of the weapon might be less than the depth of the wound. That is, the depth of the wound is more than the length of the weapon at yielding sites, high yielding sites. High yielding sites like thorax and abdomen. Thorax and abdomen. Similarly, number 2, the breadth of the weapon is equivalent to the length of the wound. It's equivalent to the length of the wound. Then number 3, the thickness of the weapon. The thickness of the weapon is equivalent to the breadth of the wound. But sometimes the thickness of the weapon is less than the breadth of the wound, or the breadth of the wound is more due to, as I have told earlier in incision as well, due to gaping. Okay, again, so the length of the weapon is, in case of complete penetration, equivalent to the depth of the wound. The breadth of the weapon is equivalent to the length of the wound, and the thickness of the weapon is equivalent to the breadth of the wound. However, if there is high yielding tissue like thorax and abdomen, the depth of the wound is greater than the length of the weapon. And if you have elastic tissue all around, then the breadth of the wound is more than the thickness of the weapon due to gaping by the collagen tissue all around. Okay. Then there is something called harakiri or seppuku under Japanese culture. Harakiri is called when it is performed by a common man, and seppuku it is called when the same thing is performed by samurai. In seppuku, the samurai stabs himself and then cuts across the abdomen in L fashion. As a result, the gut from inside spills out and the person dies, or the samurai dies, immediately. And the mode of death is evisceration, or the manner of how the death occurs is evisceration. And with that, we are done with mechanical injury.